What is a lymph node biopsy for lung cancer diagnosis? Have you ever wondered how doctors determine if lung cancer has spread beyond the lungs? One important tool they use is a lymph node biopsy. This procedure involves removing a small sample of tissue from lymph nodes to check for cancer cells. Lymph nodes are tiny, bean-shaped structures that are part of the lymphatic system, which helps the body fight infections. In lung cancer, cancer cells can travel from the lungs to nearby lymph nodes, particularly those in the mediastinum, which is the area in the center of the chest between the lungs. There are several methods to perform a lymph node biopsy. One common approach is called mediastinoscopy. During this surgical procedure, a small incision is made at the base of the neck. A lighted instrument called a mediastinoscope is then inserted behind the breastbone to access the lymph nodes in the mediastinum. This method allows doctors to see the lymph nodes directly and take tissue samples for examination. It is often used to stage lung cancer, helping to determine if it has spread to these nodes. Another method is a needle biopsy guided by imaging. This less invasive option uses imaging techniques like ultrasound or computed tomography scans to locate abnormal lymph nodes. A thin needle is then guided through the skin to collect tissue samples from these nodes. This type of biopsy is often done as an outpatient procedure and is suitable for lymph nodes that are close to the body surface. Bronchoscopy is another technique used for lymph node sampling. In this procedure, a flexible tube with a camera is passed through the throat into the lungs. Special tools can then be used to collect tissue samples from lymph nodes that are near the airways. Once the tissue is collected, it is examined under a microscope by a pathologist to check for cancer cells. The results are crucial for determining whether lung cancer has spread to the lymph nodes, which is a key factor in staging the disease. Staging helps guide treatment decisions, which may include surgery, chemotherapy, radiation, or targeted therapies. It is essential that enough tissue is collected during the biopsy to allow for thorough testing. This includes biomarker analysis, which can identify specific genetic changes in cancer cells and help tailor treatment to the individual. Like any medical procedure, lymph node biopsies come with risks. These can include bleeding, infection, and, in rare cases, injury to nearby structures such as the esophagus or blood vessels. The specific risks depend on the biopsy method used. In summary, a lymph node biopsy for lung cancer diagnosis is a vital procedure that helps doctors assess the presence and extent of cancer spread. This information is crucial for determining the best treatment options and improving patient outcomes. If you have concerns about lung cancer or the biopsy process, it is always best to consult with a healthcare professional for personalized advice.